Good morning. Welcome to a new edition of Inside Jacksonville. I'm Rebecca Davidson.
And I'm Hannah Bakshi. We're here every month from our studio on UNF campus with stories about life on the First Coast, topics that are important to you. Today we look at what may be the most controversial law that's been passed since civil rights.
It's the new healthcare law. Everyone seemed to agree that something had to be done, but that's pretty much the only thing that everyone's agreeing on. Healthcare reform passed with Democrats in control of the House of Representatives. Last year, Republicans won the majority in the House, and now they've vowed to overturn it. There's been a lot more reporting on the politics of healthcare than on the actual law itself. That's what we're going to try and tackle here today, what the new law means and what changes are coming.
Kayla Beckman joins us to kick things off with an overview.
The new healthcare bill is a big, confusing monster. It's about 2,000 pages long, this long, about the same as these 4 books. What we're trying to do today is break it down to its simplest parts to see just how the new system will affect all of us. Right now, most Americans, like these construction workers, have insurance through their jobs. That's not going to change. The biggest change will be for people who have no insurance. When the uninsured need medical care, they have to pay the whole shot themselves. That means a major illness or accident could bankrupt a family. That's what this new healthcare law is designed to prevent. Most healthcare experts say things need to change.
We have more than 40 million uninsured people in the United States. And most of the studies show that they don't get the kind of primary care and preventive services they should be getting to prevent any conditions from getting worse, like diabetes. Therefore, they tend to wait and go to the hospital, the emergency room, when things get really bad. That's a very expensive way to deal with health care. It's much better to do primary care and prevention. So if we had more people insured, they would have much better access to those early services and prevent the really expensive things.
The new law is being phased in over the next 3 years. By then, everyone will be required to buy health insurance. According to the new law, those who don't will have to pay a penalty.
So there's big concern about the cost. There's also concern about some of the mandates, the requirements in the legislation.
Republicans in Congress, now a majority, have vowed to overturn the law. Still, some parts of it have already taken effect. One of those is a provision that requires more efficient testing. In the past, when a patient needed tests, there was no limit to the number of tests a doctor could order. That's changed. Now, all of a patient's healthcare providers must agree which tests make the most sense. In turn, they receive one payment for the care provided. The next element is accountability. This part of the law puts the accountability on the providers to get it right. If doctors and hospitals make a mistake, you don't have to pay for it. UNF healthcare policy expert Don Hutton says that's a big change.
This always surprises people. Up until 3 years ago, if I was a surgeon and I made a mistake and accidentally amputated the wrong foot, I got paid for that amputation. And then when I amputated the other foot, I got paid again.
The government already has healthcare programs for 2 groups of Americans. Medicare covers people beginning at age 65. Medicaid is the safety net that covers the poor. Under the new Health Care Act, people in those programs are guaranteed coverage until they're covered by the new law. The major goal of the act is to make sure everyone has insurance. That means creating a system that allows the uninsured to buy insurance. They can do this through high-risk pools, Medicaid, or buying from private insurance exchanges. Another major goal of the healthcare law is to contain costs.
Well, the purpose is to improve the quality of health care, increase coverage, and control costs. And there are more than 2,000 pages that get into the details of how it will try to do that. And a lot of new ideas are in the legislation, but a lot of the challenge is in the detail of how those will be implemented, enacted, and funded.
It looks like one big political fight may have been averted. Florida had originally rejected any involvement with the healthcare law at all. That may change. Within the past couple of days, Governor Rick Scott did an about-face. He now says he wants to apply for federal health care funds. The reason? If Florida opted out, the state would lose nearly $100 million in education grants from Washington.
Now, Kayla, I didn't hear you mention anything about what this new law is going to mean for illegal immigrants. What kind of changes do we expect to see for them?
Right, there actually are no outline provisions for illegal immigrants right now in the new law. However, hospitals must provide care for anyone who walks into the ER, whether they have insurance or not.
Thanks, Kayla. Now, as Kayla reported, health reform is supposed to be phased in over the next few years, but one future provision may be headed for trouble. Some government experts are warning that the new long-term care program is underfunded, not enough money. Congressional investigators say that means taxpayers could be stuck with the bill. The part of the law drawing criticism is the long-term care plan for the elderly. Critics say healthy people simply won't sign up, and if they don't, the cost could go so high, no one could afford it. In other words, if the White House can't fix funding problem, long-term care may be short-lived.
Well, healthcare isn't much different than anything else. People inherently don't like change, especially the elderly.
When we come back, we'll take a look at some of the changes senior citizens should expect in their healthcare.
Should be the bump shot.
Yeah, I guess so. We'll keep talking.
That's okay.
Because sometimes, even the rescuers need to be rescued. So just call the Coast Guard Foundation. Find out how you can help at rescuetherescuers.org.
911.
Yes, water is all in the house. The roof is completely caved in on us. We need emergency assistance, please.
Okay, man, we can't respond right now because of the condition of the hurricane.
All of our neighbors evacuated and everyone is gone. Please tell me what to do.
I'm in a wheelchair and water's coming in. Is there any way I might be able to get an ambulance to help it?
The roof is coming in on us. We're going to die in this house if we don't get some help.
Unfortunately, we cannot send anybody out in this storm right now.
Welcome back inside Jacksonville. This week, we're exploring the new healthcare law.
Lots of people are in for a real change in their healthcare coverage, and our country's seniors are some of the ones who will be affected the most. I sat down with a lady who has a lot to say about her experience with healthcare. Take a look.
Connie Miller is 80 years old. She lives a comfortable life over in Arlington. She likes to keep all her things in order, including her healthcare. But like many of us, she gets confused when it comes to the new Healthcare Act. She also thinks it was passed too quickly before anyone, including the government, could really understand what it said.
Rush it through, he's saying. Just hurry and get it through. You just don't do that. You have to know what it means and how you should be able to read it and see what's in it before you pass it.
Miller is on a Medicare plan that works with her regular insurance, and she's not happy about the idea of it changing. She likes the way things are now.
The plan I'm on, why can't people be on a plan like that, where they don't pay premiums, but pay a lower amount when they go to doctors and for various tests? I don't see why other plans can't be this way.
Whether or not Miller likes the changes, the backers of healthcare reform say the new act is designed to improve things for seniors in a number of ways. It's supposed to make sure Medicare is sustainable in the future. It's also supposed to improve hospital care. But it's also supposed to help seniors save on the most used health benefit of the insurance plan, prescription drugs. Dr. May Zhao is a UNF public health professor. She says seniors often use up their prescription drug benefit too early, a problem the new healthcare law promises to address.
Medicare added that in 2006, but immediately they found out that the seniors will use out all their money, a lot of those the first week. So they cannot continue because of this huge, big donut hole. So that's why the healthcare reform law tried to help the seniors to fill that gap.
So where does the money to fill that gap come from? Well, it's hospitals like this one that will be taking the hit.
It's not unusual for seniors and other hospital patients to develop infections. In fact, 1.7 million healthcare infections occur in hospitals each year. Traditionally, Medicare has covered the cost of treating these infections for seniors. Not anymore. Dr. Rob Haley is a professor of public health, and he says the cut in hospital bills is a good thing.
Hospitals have a big incentive to help to reduce or eliminate infections that are caused in the hospital, which we all win from that.
Haley says this is especially an issue today because so many Americans, baby boomers, are now hitting the Medicare age of 65.
They call it the age wave, so the wave of the baby boomers is now growing older. And what happens as we grow older? Well, we use health care. I mean, it's just part of growing older. It's just part of the aging process.
Will the new healthcare system work? That's the debate. President Obama promises that for seniors, it will.
Steps will ensure that you, America's seniors, get the benefits you've been promised. They will ensure that Medicare is there for future generations.
Despite the promises, Connie Miller says she isn't about to stop worrying about health care, and not just for herself, but for her children and grandchildren as well.
I do worry about what's happening with it.
Talking with Miller gave me a better understanding of how the new law is going to affect seniors and what it really means to them.
Well, Rebecca, it sounds like this law is going to help seniors out with prescriptions, but the real question is, will it change their regular benefits?
Well, when I talked with Professor Zhao, she said that some of the benefits that allow many seniors to go to a primary care doctor are probably going to change, but President Obama has promised to do his best not to let that happen.
Gotcha. Now, another group affected by the new healthcare law, young people. Critics say they won't buy in, but recent surveys show people between 19 and 25 years old are buying insurance. In fact, the young is the only group of people buying more insurance, not less. Nearly 1 million new policies in 2010, and the Department of Health and Human Services predicts another 500,000 will be insured by the end of the year. Jeff Waterhouse explains what the new law means for those under 26.
Stephanie Baker is a young mother of 2. Ty is 3 years old, and 1-year-old Allie. Baker can't afford health insurance right now. They're covered by Medicaid, the government-sponsored plan that is used as a safety net for those who can't afford private coverage. Baker says the out-of-pocket costs are low, but so are the options.
I mean, we have to go to very specific doctors, and sometimes that can be a challenge to find the right doctor that you like, that you also know you're allowed to go to, and sometimes I have problems with certain prescription brands. But for the most part, yeah, it works out great. I'm very happy to have free insurance, you know. Can't really afford insurance otherwise.
There are millions of Americans like the Bakers, unemployed or underemployed, and many of them are young adults. Hugh Green is the president and CEO of Baptist Health. He says there are also a lot of young adults who aren't insured.
Well, I think it's a combination of affordability, they don't have it through their employer, and what you've stated is they don't think they need it because they have no health problems and they don't really see that they're going to have it.
But Green says when people need a doctor or a hospital, no matter what the age or the circumstance, expect treatment.
One of the things that's important to understand is that in this country, overwhelmingly, 90% of the people believe health care is a right. And because we believe it is a right, by law, a hospital emergency room cannot turn someone away because of their inability to pay.
And when that happens, someone has to pay the bill. But who? The rest of us. people with insurance and those who can afford to pay themselves, in the form of higher costs. Mark Doyle, the Chief Financial Officer at St. Vincent's Medical Center, says those costs can add up.
Yeah, the average charge for an ER visit, and most of those are kind of slips and falls, you know, kind of athletic injuries, can be as little as probably $500 and up to $10,000 just for one ER visit.
That's just for the visit.
That's for the visit, and a hospitalization on average is probably about $10,000 a day they drive up. So the impacts for someone without insurance, going to the ER, being admitted to the hospital, can be really significant and put a really financial burden on the individual.
One significant group of younger people is students. Most universities offer basic health services for a small fee included in tuition bills.
Each and every student that registers for a class and pays a tuition dollar pays $3.04 in their tuition dollar. It's called a student credit hour, and that gives you the opportunity to use this center as many times as you want.
Noreen Perez is the Director of Student Health Services at UNF. For major off-campus medical services, she says students who aren't covered by their parents' plans can buy optional insurance coverage through the university.
And so what we find is insurance for the students that they can afford up front and that actually gives them coverage, the coverage that they need.
There's one new thing the healthcare law is changing for students and all other young people, and it's a big one: eligibility. Students are now allowed to ride on their parents' insurance for a few more years.
Well, the first thing that really was implemented in the Healthcare Reform Act was that children who are dependents can stay on their parents' employer health insurance until they're age 26. So for even an organization like Baptist, we added a number of people to our insurance coverage that are in college or post-college up to age 26. It really was that which had an impact on the cost of our insurance, because those people now can be on those policies.
One other change is designed to help young people like Stephanie Baker who aren't covered through their parents or employers. The plan would allow her to purchase coverage through an insurance exchange, greatly expanding her choice of doctors and healthcare providers.
It really makes me happy to know that I'll be able to get a good health plan when I do get a job.
Jeff Waterhouse, Inside Jacksonville.
Jeff's interview with Baptist boss Hugh Green was especially insightful, more than we can include here. If you'd like to see the entire interview, just go to our UNF TV webpage, www.unf-tv.com, follow the link to Inside Jacksonville, and then to the Hugh Green interview. As we mentioned earlier, this new healthcare law is the most politically charged issue in the decades.
Why is that, and what does it mean for you? We'll hear from a guy who's a pretty sharp political observer right after the break.
Hi, I'm Judy Rodriguez, a nutrition professor here at the University of North Florida in Jacksonville. I really think, in looking at the curricula and the programs here at UNF, that they're excellent, that they have a good blend of theory and practice. I always have an open door policy for my students. They'll ask me questions that are really different and outside of traditional thinking. It keeps me on my toes. It also helps me learn from them. UNF, no one like you, no place like this.
Hi, I'm Rachel Tutwiler, majoring in political science with a minor in public administration at the University of North Florida in Jacksonville. When I'm walking around campus, it's beautiful. It's built right on a nature preserve. I feel myself being very comfortable. I think it's perfect. At UNF, I've been able to find the perfect fit for me. I've been able to develop both personally and professionally. UNF, no one like you, no place like this.
My name is Sean Hamlin, and I'm majoring in jazz studies at the University of North Florida. Musically, I'm a totally different musician than I was before I came to college. The professors are pretty personable, and they're always there if you ever need them. Living in Osprey Hall was a very social atmosphere. I'm right on campus. I don't have to fight traffic in the mornings. UNF was a great choice for me, musically and academically. UNF, no one like you, no place like this.
Welcome back to Inside Jacksonville. The whole healthcare issue has been a very bitter political fight. A major battleground Republicans and Democrats have chosen to draw their lines in the sand.
To help us understand the political fight, we decided to ask a veteran politician. UNF President John Delaney was a state attorney, mayor of Jacksonville, and has been frequently mentioned for statewide office. President Delaney told me the reason the fight is so bitter is two very different political philosophies.
The Democratic Party, which has always wanted people to kind of be an equality of living standards, and are looking out for people that don't have health care and that run into a health problem and then don't have the money to pay for it. And then, of course, there's many diseases that sort of are incipient. They get worse and worse over time, but if you treat them early, you can actually save money later. The Republican Party has tended to be more about individual freedoms and individual responsibility. And so the idea of having a government-imposed mandatory health plan just flies in the face of the philosophy of that party. I think the real cutting point has been the idea that the government can require you to buy health insurance, and that's what, and it's been declared unconstitutional in most of the courts that have looked at it. What's known as the individual mandate, the requirement that you have to buy insurance. One of the reasons for that requirement is that healthy people don't really need health insurance, and so you've got to have healthy people in this pool paying insurance premiums to be able to have the money and the resources to pay for the treatment of the sick. That's really what insurance is about, is you pool the risks, and so if you're sick, somebody else's money is paying for your treatment. When you're well, you're paying for somebody else's treatment.
Absolutely. Now, when we talk about Florida participating in this whole plan, now if it refuses to participate, what does that make the, how does that affect the state altogether?
Yeah, well, that's a great question. The most states in the country believe that their citizens can't be mandated to buy health insurance and participate in this federal plan. And I think 32 states have actually sued, all Republican, have sued to say you can't force this on the states, and it's what's known as really a states' rights versus federalism argument. Right. Who really is in charge here? And so it's a pretty interesting, if one is a lawyer, constitutional argument on whether or not the federal government can impose this on the states. So multiple states have sued the attorney generals, and in some cases the governors, to say we don't want any part of this. I think what's sort of interesting is that clearly the federal government could have taxed all of the citizens and bought the insurance and then given it to the citizens. But when President Obama sold the plan, he says it's not a tax. There'll be no taxes. And so that's tripped up some of the court cases, because the argument really is, well, this is in effect a tax. We're making you buy this insurance, and so that's the equivalent of a tax. And I think ultimately it'll turn on whether or not it really is perceived to be a tax, or whether or not the Commerce Clause of the Constitution will allow Congress to regulate the citizens in such a way. Frankly, my bet is that it's unconstitutional, that individual mandate.
So can we foresee at all where the state of Florida can stand by 2014? Are we going to be left behind a little bit, or are we going to catch up?
Well, again, I don't see any circumstance where the state would abandon Medicaid funding for the poor. I don't see any circumstance for that. The question is, at what quality? Right. You know, how many different things will we cover? How many different diseases will we cover? How much and quality of treatment will we cover? Right. But what they want to do is to be able to administer the plan differently than sometimes comes down as a state mandate. But that changes with every governor and legislature, so I'm not really sure where they're going to go.
Despite last year's passage of the healthcare law, Delaney predicts much more political debate in the near future.
Don't go anywhere. We'll be right back. That's great.
That was good.
That was good. I think.
I love you. Bye, Dawson. Say bye-bye, Mommy.
Hey. Haven't seen you lately. How have you been?
Well, things got crazy there for a minute. I tried my best, but it was really hard. Dawson's teacher, Miss Jones, she took time and talked to me about getting help, and now we're doing pretty good.
Isn't she great? She helped me when I was having trouble potty training my son, and I don't know what I would have done without her.
It's your turn to raise the leaders of tomorrow. Find out how at ounce.org.
Hi, my name is Zachary Champagne, and I'm an education graduate student here at the University of North Florida in Jacksonville. I've had very close relationships with the professors, with the community here. Being able to keep in contact with so many professors and so many classmates make me a better educator. I'm taking things into practice that are really groundbreaking ideas, things that a lot of other educators aren't doing yet. It has been an extremely positive experience throughout all of my time here. UNF, no one like you, no place like this.
Ever wondered where your water comes from? For most of us, it comes from aquifers beneath the ground. Imagine a sponge full of holes. Porous rock, sand, shell, and limestone hold water and allow it to move. Water is drawn from the ground through wells. Though rain refills our aquifers, we're using water faster than rain can replenish it. Learn how you can help conserve our water at floridaswater.com.
Welcome back. Our topic today has been healthcare, the changes we should expect to see, and the politics surrounding the issue.
Whenever there's a fight, there are winners and losers. We did a little research to find out who's who when it comes to healthcare. Observers say a big winner are the drug companies. That's because they won't have to give hospitals discounts on medicines anymore. But hospitals are also winners too. Even though they'll lose money because Washington is cutting Medicare and Medicaid payments, they'll more than make it up because more and more people will be insured, meaning far fewer write-ups. And one group of losers is the generic drug makers. They'll have to wait at least a decade before they can sell their low-cost replicas. And another loser is the tanning bed industry. Salons will soon have to pay an extra 10% tax on their services. The estimated new revenue from those tanning salons is $3 billion.
Thanks for joining us on Inside Jacksonville, where we report the issues that are important to you.
We hope you've enjoyed the show. Join us next month. Our topic will be domestic violence, and it may be a bit closer to home than you might think. And if there's a topic you'd like us to cover, we want to hear from you. Check us out on the web at www.unf-tv.com/InsideJacksonville. Again, that's www.unf-tv.com/InsideJacksonville. Also, you can find us on Facebook and YouTube. Well, thanks for spending part of your Sunday morning with us.
We'll see you next time on Inside Jacksonville.